All right, I've done this one a couple of times. I'm trying to get it right and cohesive. This is reading. We are reading from phmpt.org. These are Pfizer's documents from the Public Health and Medical Professionals for Transparency documents. We're in the document 5.3.6, post-marketing experience. On that PDF, we are on page 30. And that is the Appendix 1, list of adverse events of special interest. This adverse event is acquired C1 inhibitor deficiency. So I just do a general search. I've looked at a lot of them. They always add extra little words in, so I'll just show you. This is what I read in the first one. It's C1 esterase inhibitor deficiency, so that esterase isn't in the definition. Also known as hereditary angioedema, results in the unchecked production of the vasodilator bradykinin. This increase in bradykinin leads to an increase in smooth muscle relaxation in the walls of blood vessels and resultant edema in the hands, feet, gastrointestinal tract, and in severe cases, the larynx. In severe cases, the airway can be compromised and effectively swollen closed, preventing air movement into and out of the lungs. This activity reviews the presentation, evaluation, and management of C1 esterase inhibitor deficiency and highlights the role of interprofessional team in caring for patients with this condition. So that's C1 esterase inhibitor deficiency. What we're looking for is acquired C1 inhibitor deficiency. I believe they're speaking of the same thing, but I don't take my word for it. So then I have this one from PubMed, NIH.gov. That last one was NIH.gov again, National Library of Medicine. National Library of Medicine again. All right. Acquired C1 inhibitor deficiency presenting with nephrotic syndrome. An abstract. Acquired C1 inhibitor, C1-INH, deficiency is a rare and potentially life-threatening disorder which presents with recurrent attacks of non-pitting oedema to the face, airway, limbs, or gastrointestinal tract. It is often associated with underlying B-cell lymphoproliferative disorders. We describe a case of a 73-year-old man with acquired C1-INH deficiency who presented with nephrotic syndrome due to granular glom. Oh man, I can't read. I should almost start over. Glomerular LGM deposition, secondary to an underlying secretory lymphoplasmacytic lymphoma. Both the acquired C1-INH deficiency and the nephrotic syndrome resolved when the underlying B-cell lymphoma was treated with rituximab and bendamustine, suggesting the underlying lymphoproliferative malignancy was driving both disorders. This is keyword hematology, including blood transfusion, immunology, renal system. That's another one, acquired C1 inhibitor deficiency presenting with nephrotic syndrome. All right, this is pain assistant from epainassist.com. I don't want to speak to their accuracy or anything, but this one says C1 esterase inhibitor deficiency signs, symptoms, etiology, investigations, and treatment. A genetic change A genetic change in the C1 inhibitor gene on chromosome 11 causes C1 inhibitor deficiency. C1 inhibitor deficiency attacks are often misdiagnosed for anaphylaxis and also the treatment given during anaphylaxis, such as adrenaline, antihistamines, and steroids, are ineffective in this case. And this one is from uptodate.com. Acquired C1 inhibitor deficiency management and prognosis. I'm just going to read a little bit more. Introduction. Acquired angioedema due to deficiency of C1 esterase inhibitor, also called acquired angioedema and abbreviated C1-INH-AAE, is a rare syndrome of recurrent episodes of angioedema without urticaria, which is associated with B-cell lymphoproliferative disorders in some patients. I just want to point out angioedema is in this list here. I've had to do this a couple times, so I just want to show it to you. Angioedema. So it's right here. It's something that comes up, but we're not to that one yet. Where was I? Angioedema typically affects the skin or muscular mucosal tissues of the upper respiratory and gastrointestinal tracts. The swelling is self-limited, although laryngeal involvement may cause fatal asphyxiation. Clinically, this disorder is very similar to hereditary angioedema, although acquired angioedema develops in older patients and is frequently associated with underlying disease, whereas the hereditary disorder presents in younger patients who are otherwise healthy. So, in the list of acquired or of adverse events of special interest, it says acquired C1 inhibitor deficiency, and these are about acquired C1 inhibitor deficiency. That's about as good as I can define it. It's related to angioedema. It sounds. I just want to define terms. I just want to know what these terms are. It's the end of the video.